Today I will be performing a neurological assessment. First off, I will start with assessing orientation and level of consciousness with the Glasgow Coma Scale. So I will walk in and introduce myself, and I can see that her eyes are spontaneous to movement and to my sound, so she will get a 4. Then I will test verbal response. What's your name and date of birth?
Hannah Doman, 10/14/99.
And what town are we in right now?
Brookfield.
And what day is it?
Saturday.
Her verbal response is orientated, and so she will get a 5. Then I will check her motor response. Can you reach up and grasp my fingers? She's perfectly fine with obeying commands, and therefore she will get a 6. And overall her score is 15, which is a perfect score. I will then observe her posture and position. She's sitting upright and doesn't appear to be in any pain or discomfort. Her general appearance is appropriate for the situation. She's clean and has good hygiene. Are you in any pain right now?
No.
If they say no, I don't have to elaborate on the pain assessment. Then I can check her vital signs. Her temp is 98.6, heart rate is 80, BP is 126/80, respirations is 16, and SpO2 is 98 on room air, which is all within normal limits. Then I would check visual deficits with cranial nerve 2, so if you can just read that right there.
TULV.
And she is correct. Then I can check hearing deficits, which is cranial nerve 8, so if you could just cover up one ear, and I'm going to whisper.
You said apple?
Other ear. Banana.
You said banana.
And she's correct, so she doesn't have any hearing deficits. Then I can check recent and remote memory, so who is the president?
Trump.
And what did you have for lunch today?
A sandwich.
All right. And based on the way that she's been speaking to me and responding to me, I can see that she does not have any speech difficulties or deficits. Then I can do the eye and pupil assessment, which tests cranial nerve 2, 3, 4, and 6 with pupil reaction. Then if you could just look at that clock and back here. All right, and then just move your eyes to where my pin goes. All right, her pupils are perla and perfectly fine. I can then test motor function with cranial nerve 7, so I'll ask her to smile, frown, and puff out your cheeks. She's perfectly fine. And then I can test cranial nerve 8 with the Romberg test, so if you just stand up for me and close your eyes. For this, I'm looking for balance and swaying, which she does not have, so she's fine. And then I will test her gait, so if you just walk over there for me and back. Her gait is steady and perfectly fine. You can sit down. Then I can test muscle tone, strength, and coordination, so I will do grips. They're equal and strong. Then, up towards you, and down like pushing car. Her grips and presses are both equal and strong, which is good. And then I will test against resistance. So if you can hold out your arms, and push up, push down. Same with legs. Push up, push down. All of them are equal and strong as well. Then I can test sensation. So I will touch you and tell me when you feel me.
Touch, 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 touch.
Then tell me if it's sharp or dull.
Dull, dull, sharp, dull, dull, sharp, 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 dull.
All right, her sensation's perfectly fine. Then I can test gag reflex, and swallowing. Her gag reflex is fine. And then if I can have you swallow some water. And then I would observe her for any swallowing issues. Then you can test deep tendon reflexes, so I would hit on her. And those are perfectly fine. And this includes assessing for the Babinski reflex. Normally, this would not be in an adult, and it would only appear in newborns where their toes fan out. And that's it.